The Centers for Disease Control and Prevention has released new COVID-19 guidelines that have some scratching their heads. The confusion lies with testing and quarantine times, but one local doctor is breaking it all down for us. News 13's Emily McLeod live in studio tonight. Em, what are some of the biggest differences between Omicron and the other variants?
Well, Amy, Dr. Roman Nation says the variant itself is milder but more contagious than the Delta variant. While some believe the new CDC guidelines are as clear as mud, Nation says people need to simply listen to their bodies and track their symptoms. The Centers for Disease Control and Prevention recently released new COVID-19 guidelines in response to the Omicron variant, but they've left people confused about if and when they should get tested or quarantine.
This round has been is nowhere near as bad from what I can tell, but it's still significant because you're still having people get sick and you're still having at-risk people get debilitated, and really the fear factor is a significant problem for everybody to work with.
Local physician Dr. Roman Nations recommends tracking your symptoms to determine when and if a 5 or 10-day quarantine is necessary.
And so once you get tested and you're positive, then you watch for your symptom improvement, because you'll have some people where their symptoms start to get better just after a few days, and those are the ones that are the least contagious 5 days afterwards. So that's where the mask after 5 days but go back to work is really aimed at trying to get the economy back rolling and keep the labor shortage to a minimum and minimize the number of exposures to other people as far as contagiousness goes.
He says those who still feel sick after 5 days should continue to quarantine for the full 10 days, but it also depends on who you work with.
If you're somebody that works, around elderly patients, like in a nursing home or in a cancer facility, or somebody that works near a daycare facility where you're around little children, those are all things that can get other kids sick because they can take it home and then spread it to the rest of the family.
Also, if you have COVID symptoms but your rapid test is negative, Dr. Nation says you shouldn't depend on those results for your diagnosis.
If you've got symptoms, even if your test is negative, it's highly likely that you still have COVID.
He says the rapid tests are designed to be accessible, but they're not as accurate.
And the rapid tests, unfortunately, still, even under the best of circumstances, still miss at least 10% of the infections. The home kits, actually, in symptomatic patients, still miss 30% of the infections.
Now, there's also been some recent debate on mask effectiveness. Dr. Nation says, yet again, it depends on what you do for a living. He says if you have contact with a lot of people like someone in retail might, you may want to consider something a little stronger like an N95.
And Emily, let's talk a little bit more about Omicron. What are those symptoms?
Well, to add to the confusion even more, Omicron and flu symptoms are very similar. Dr. Nation says they are seeing body aches, chills, and fever.
All right, good information tonight. Thank you, Emily.